Hi, I'm Dr. Gonzalez from the Performance Place. Did you know shoulder pain can actually be for multiple different reasons and almost feel the same way to you? So being misdiagnosed and being treated ineffectively is a very common problem, and if this happens to you, you'll miss out on a lot of training time and actually miss some of the optimal periods for recovery for that condition itself. Today in this video we're going to go over the most common reasons for athletes or overhead athletes to have shoulder pain. And our goal is to let you basically know what you don't know already so you can become better educated. Keep listening as we highlight a case today that we had come into our office of shoulder pain in a high school girls basketball player, which could have easily been misdiagnosed if not looked at properly. So what happened to this girl, and we'll just call her Anna, was that she was playing and she got her arm caught with another girl. So it got pulled back behind her and she felt a pop. So her and her mom were devastated, and they came in and they asked basically when she can play again. And what I told them was basically this: it depends on the injury itself, what it actually is, and it actually depends on the severity of the injury. So again, injury itself and the severity. The first thing we need to consider with this athlete was a rotator cuff tear, and mainly because she felt a pop when it happened, and it was just right in here she was pointing at. The supraspinatus is one of the most common areas to be torn in an athlete's shoulder. So again, rotator cuff tears are very common overall in general to happen to athletes. However, it doesn't always have to be in regards to trauma or a fall. So usually in older athletes, and I don't mean 50, 60 years old, but sometimes 20s to 30s, you have repetitive use injuries or repetitive rubbing they call it. So a tendon, as it starts to rub on an area over time, it tends to weaken and then a tear will happen there as well. Sometimes these people have pain at night, usually sleeping on that shoulder. So does she have this? Does she have a rotator cuff tear? Well, it's possible. And usually to evaluate this best, we use something called MSK ultrasound, which is a very useful tool looking in the shoulder to evaluate rotator cuff tears and the integrity of the shoulder as a whole. It's almost like looking inside a pregnant lady and seeing a baby, except for in this case we're seeing muscles and tendons. So in this case we're seeing actually a normal study. And you see the rotator cuff actually looks like it's complete. There's not a lot of black in it. We don't have a large tear. But in this case, over here, we do see that there is a large tear. And you can see that by the black void of tissue within that same location. So I'll show you again. We have normal and we have abnormal. In this case, Anna might be receiving surgical intervention, PRP injections, or other types of treatments. But I'm not saying this is Anna or not, but also if she'd been receiving treatment and misdiagnosed, she would not be improving at the rate that we would expect for a rotator cuff tear. So impingement syndrome is really the next thing we have to consider. It's actually not very high on the list of probabilities with Anna, and mainly because she felt that pop and there's a little bit of trauma involved. Impingement syndrome sometimes develops a little bit later. It does have decreased range of motion, and also too, it does hurt when you lay on that side at night, so a lot of times it'll wake people up. I think earlier in this video I said that shoulder or rotator cuff tears hurt when you lay on them, but actually those hurt regardless of position. So impingement syndrome more when you lay on that side. Now, one thing I like to use with diagnosis of this condition is going to be musculoskeletal ultrasound or MSK ultrasound. It's a dynamic study, and by that we mean that we can see things move. All right, and what we're looking at in this case is usually when we do some orthopedic tests, we confirm, well, maybe this could be impingement syndrome. And this is where the supraspinatus muscle and the bursa above it kind of slide underneath this bony area, or the acromion on the shoulder. And those typically become impinged when they're not moving well, giving that name of impingement syndrome. So as I move my shoulder up, all this white stuff is supposed to slide underneath. And if it doesn't slide underneath, it can get caught, and that's what's known as impingement syndrome, but you can probably see that move. So we're looking for that slide, and a lot of people will say, well, I had x-rays and this is negative, I don't see how it could be that. X-rays really only show bony anatomy. They don't actually show soft tissues very well, and they actually don't show motion. They're static images, we call them. So ultrasound is a little bit better in this case, actually a lot better in this case, to diagnose these conditions. Now, number 3 on our list is going to be a labrum tear, and a lot of people won't know what a labrum is, but it's actually a cartilage cup in the shoulder, and a lot of times this will prevent in a variety of ways. It's usually trauma-based. It doesn't have to. Actually, a lot of baseball pitchers get this, but in this case, she had a little bit of trauma, so the pulling of the biceps tendon backwards can actually pull on this labrum or the cartilage and tear it a little bit. So a lot of times people with this type of condition will have pain on the front part of the shoulder, right over the biceps tendon, sometimes in the back a little bit more underneath the deltoid, but it can present in a variety of different ways, and the overall severity of the tear can be very different as well. Now, to rule out a labral tear in Anna's condition, we actually used a musculoskeletal ultrasound, or MSK ultrasound. The labrum is really deep in there, and you can't get ultrasound really deep in there. The fact of the matter is, I like to say that if there's smoke, there's a fire, okay? And this is the rationale behind it, and it's a good scanning test. So if there's two spaces right here, here's a bone, and here's the internal portion of the shoulder, and you can kind of see a window. If there's swelling coming out of it, then there's probably a fire, all right? So, or smoke, there's a fire rather. So if there's swelling coming out, there's going to be something deep inside the joint, which can be a labral pathology, it can be a fracture, it can be a lot of things. But either way, usually this is a good scanning test to see if anything's coming out which will merit a larger type of image called an arthrogram. And one area you can visualize the labrum is the back part of the shoulder. And you'll see all the bond socket right there. And I'll freeze it, and we'll go back and I'll point. So here's the ball of humerus, here's the labrum over here, and here's the outside portion, or they call it the glenoid rim, and you can look these terms up on Google. Now realize we talked a lot about imaging. You might say, I don't really care about the image, I just want to know what it is, and blah blah blah. But at the same time, from a medical standpoint, the imaging is very important, and if we don't know exactly what we're treating, we can't treat it effectively. We also know there's not a lot of education out there on musculoskeletal ultrasound or MSK ultrasound, so in the Southern California area, I don't know a lot of people that actually do it. If you guys are around, feel free to come in and get yourself checked out. We'll at least guide you in the right direction of what you should do. Now that you're pretty confused about what you have, actually just know that was actually the point of this video, is that we want to make sure that people realize the things they don't know. And I think that's part of the danger of self-diagnosing online, is you don't know the things that you're looking up because you're only kind of homing in on these few things, and there's all these other things it could be. So just realize self-diagnosing, bad idea. Self-treating is a bad idea. And just go in and spend the money and the time with someone who's going to know exactly what you have and guide you in the right direction. There's no substitute for years of experience and education in sports medicine. So my recommendation generally with these types of things is going to be, first, get an image. MSK ultrasound is one of the best things I've found. Second is go find someone who can read that image or guide you in the right direction, such as a sports medicine doctor, sports chiropractor, physical therapist, someone of that nature. And lastly, go in and actually be open-minded about doing what they say, because I've encountered lots of people, lots of patients who have come in and done the exact opposite from what I've recommended. And personally, I think that if they're coming in to pay me to take a look at you, you should probably listen to what I have to say. So I hope this helped you guys out, and feel free to check out our other videos.